I'm Abby Nerlinger. I'm a pediatrician at Nemours Children's Hospital, Delaware. I am co-chair of the planning committee for the Community Research Exchange this year, and I'm the Nemours site lead for the Community Engagement and Outreach Corps. On behalf of the planning committee, we were pleased to welcome you to the 12th annual Delaware ACCEL Clinical and Translational Research Program Community Research Exchange. This Community Research Exchange is a collaborative forum that engages community members with the goal of improving health outcomes across Delaware. This year's theme, Community-Based Approaches for Chronic Disease Prevention, specifically aligns ACCEL priority research areas with the 2025-2028 Delaware State Health Improvement Plan related to chronic disease prevention and outcomes. Throughout the day, you'll hear from speakers across a range of discipline, including researchers, policymakers, public health officials, and of course, the community. As part of the morning session, we will have the opportunity to hear about updates from the state of Delaware and outside Delaware through our keynote speaker, Dr. Winder. We will hear from a panel highlighting Delaware's steps to evaluate and implement food as medicine programs in the state, and then podium presentations that highlight Delaware researchers who have been successful in engaging the community to prevent chronic disease outcomes. We hope you'll join us for the interactive afternoon sessions that focus on skill building, including research collaborations, mentorship, artificial intelligence, community education, and funding. When I was attending a community listening meeting recently for the upcoming Nemours Community Health Needs Assessment, one community member offered this insightful quote, "Health lives in community." We know that engaging with communities to identify research needs and implement solutions is the most effective way to improve health outcomes for all Delawareans, regardless of race, ethnicity, gender, age, disability, or address. With that, we hope you're able to build connections and collaborations that help keep our communities healthy and live the healthiest lives possible through chronic disease prevention. A few housekeeping items before we start. Please be sure you've checked in, receive your name tag and lanyard. Restrooms are located behind the auditorium in the back, and on the table you'll find QR codes, including the CME QR code, the post-conference survey, which we please encourage you to complete. And then additionally, the QR code for the program booklet. Oh, slides are switching. This is information for the CME for the program. And then with that, I am going to introduce our next speaker. Switching back in slides. Dr. Lee Pachter. Dr. Pachter is a senior physician scientist and director of mentorship and professional development in Christiana Care iReach, the Institute for Research and Equity in Community Health. He is professor of pediatrics and population health at Sidney Kimmel Medical College and the College of Population Health at the Thomas Jefferson University, and he is the core lead for the ACCEL Community Engagement Outreach Corps. Thank you, Dr. Pachter.
Thank you, Abby, and welcome, everybody. This is great. It's my pleasure to welcome you to the ACCEL Community Research Exchange. We have a very exciting day ahead, and I want to thank the CRE Planning Committee, Abby, and the rest of them for really putting on an amazing program on chronic illness and community-engaged research. Before I turn over the program to Greg Hicks, the PI of ACCEL, I'd like to acknowledge that today, first of all, a little bit about the CEO Corps. The Community Engagement and Outreach Corps of ACCEL, our mission is to make sure that community perspective and community voice is really front and center in all that ACCEL does. We have a Community Advisory Council, which is very active and helps us make sure that we represent all the different communities in Delaware, both geographically and everything else. We make sure the community voice is heard through a number of different ways. We offer community engagement consults to any researcher in the state who's interested in doing research and making sure that they have the most up-to-date community engaged perspectives. We also have the Community Advisory Council and community engaged researchers review pilot proposals, which are research proposals that go through and are funded by ACCEL. And we also have out-facing events, this one being the largest ACCEL out-facing event of the year, and it is front and center community. So before I turn over the podium to Greg Hicks, the PI, I'd like to acknowledge that we're standing here today in the area that is the ancestral home of the Lenape and the Nanticoke nations, both of which are formally recognized by the state of Delaware. The Lenape's history, their territory spans from Delaware, New Jersey, eastern Pennsylvania, up to New York, Long Island, and the Hudson Valley. During the 18th century, most Lenape were forcibly removed from their homeland. In the 1860s, the U.S. government sent most of the Lenape out west to the Indian territories in Oklahoma, although we still have a vibrant Lenape community here in Delaware. The Nanticoke traditional homeland is a little bit lower down in the state, in the Chesapeake Bay and in southern Delaware. In the 1700s, they purchased 3,000 acres in Sussex County, and the Nanticoke Indian Association, which is headquartered in Millsboro, was recognized by the state as an official indigenous tribe in the 1880s and again in the early 2000s by Governor Markell. So I'd like to thank you for listening to this land acknowledgement, and now I'd like to bring up Greg Hicks, the principal investigator of ACCEL.
Good morning, everyone. I'd like to take the opportunity to welcome you to the 2025 ACCEL Community Research Exchange. My name is Gregory Hicks. I am the director of the CTR ACCEL program, also associate vice president for clinical and translational research at the University of Delaware. It's really great to be back together again here and see everyone come out to the Community Research Exchange. This is really one of the central outreach opportunities that we have as a part of ACCEL. So some of you may not be familiar with the ACCEL program, but it is funded by the National Institutes of General Medical Sciences, which is a component of the National Institutes of Health, or NIH. We also receive very generous matching support from the state of Delaware, for which we're very thankful. The mission of the CTR program that NIH has is to build infrastructure for clinical and translational research within the state of Delaware, with the idea that we would improve the health of all Delawareans. And that really is essential to everything that we do as a part of ACCEL. The institutions that make up ACCEL here in the state of Delaware are the University of Delaware, Christiana Care, Delaware State University, and Nemours Children's Health. And we've been working together. This is the start of our 13th year working together. And we're very proud of the work that we've been able to do here in the state. One of the key goals for the ACCEL program is to enhance model community engagement outreach research programs that work with the state and other stakeholders to promote health and wellness to diverse populations of Delaware. And this year's Community Research Exchange, which has a focus on chronic disease management, I think is really critical at this point in time. It really speaks volumes to the work that we hope to do here in the state. I want to thank our esteemed co-chairs, conference co-chairs, for their significant efforts in bringing yet another engaging conference. Our conference chairs this year are Abby Nerlinger, Omar Khan, Gwen Anglais, David Chen, Allison Carpin, Bianca Nugent-White, and Missy Bollinger. And of course, we have Lee Pachter, who's the lead for our Community Engagement Outreach Core. These co-chairs have really worked diligently to ensure that the community has been included from inception to ensure that your voice is heard. And we hope that today is a great day, and kudos to our team who put this together. We're very thankful. And with that, I will bring up our next speaker, Dr. Omar Khan, who is Chief Scientific Officer here at Christiana Care.
Good morning, everyone. Oh, that was not good enough. We should, for those of you who know me, this will not work. Good morning, everyone. All right, thank you so much. We have our previous co-chair here, Marlene Saunders, in the audience as well, who I want to acknowledge. She would always make sure we were starting, we were engaged, we were interested. Thank you, Marlene. Thank you to all my co-chairs, and a special thank you to Dr. Greg Hicks, the principal investigator for ACCEL, for getting us this far. We're now in round 3 of our ACCEL funding here, which means we're now in year 13, Greg, if I'm not mistaken. This is our 13th Community Research Exchange. And for those of you who may remember a younger version of me 13 years ago, yes, I'm the same person. Several of you look exactly the same, which is wonderful. I probably don't. But I really want to thank all of you for being here today. I want to give a special thank you, by the way. I know you'll hear a lot of thank yous throughout the day, including to most of you. But our conference organizers who've done a terrific job, Karen Wilkinson and Lacey Long, they're the ones who really made a lot of this possible today. And in addition, today is also Lacey's birthday. So will you give them a round of applause, please? Thank you so much. I bring you greetings, as Dr. Hicks said. ChristianaCare is very proud to be one of the key ACCEL partners since the very beginning. I bring you greetings from Dr. Janice Nevins, President and CEO of ChristianaCare, and from the ChristianaCare Board and our senior leadership, including several who are here today, including Dr. Neil Jasani, our Chief Academic Officer. They have really supported this concept of ACCEL community engagement since the very onset. This is a community-based organization. It's also one of the country's largest health systems, but is always working closely in partnership with you all, the community, and our partners across the state of Delaware. As I mentioned, this is our 13th conference. Dr. Hicks and Dr. Nerlinger mentioned our 4 main academic partners, but we have other really important partners. The community, of course, is our perennial foundational partner in all that we do. But in addition to that, the state of Delaware. The state of Delaware is also a key partner since the very beginning and invests time, money, resources, and intellect in moving this work forward. It has become somewhat of a tradition to invite a state leader to speak to you and to demonstrate also the commitment we have of shared population health across the state. I'm pleased to introduce to you today Dr. Neil Hochstein, who's chair of the Delaware Healthcare Commission and who's representing the governor of the state of Delaware, Matt Meyer. I'll tell you a little bit about Dr. Hochstein as well. Dr. Hochstein completed his undergraduate work at Johns Hopkins University. He went for medical school to Sidney Kimmel Medical College and his residency and fellowship at the University of Pennsylvania in otolaryngology. He is an otolaryngologist and head and neck surgeon. For many of you, that means he's an ENT. He is the lead partner in the ENT, large ENT practice in Delaware, and the chief medical officer for Parallel ENT, which is the national organization that manages those groups. Many of you are familiar with Dr. Hochstein from his clinical expertise and academic expertise. He is also the head of head and neck cancer care at the Helen F. Graham Cancer Center at ChristianaCare. He's been named one of Delaware's top doctors, I think, for 16 years running. But most importantly for me, Neil is actually a close personal friend. He is a wonderful partner to bounce off ideas for healthcare policy, for workforce, how to advance medical education. Whenever we meet along with our other colleagues, we're always talking about, and he's coming up with innovative ideas to advance the health of Delawareans, and I'm proud to say that he does that every day. Please join me in welcoming my dear friend and colleague, Dr. Neil Hochstein.
Good morning. Thank you, Omar. That was too kind and too long of an introduction. So I have a lot of different jobs. I volunteer for the state of Delaware. I represent a multi-state management services organization. I practice ENT. I support ChristianaCare's cancer program. And so often when you're giving a talk, your first slide is a conflict of interest statement. And I am completely conflicted in that when I'm representing my practice, sometimes I'm fighting with the insurance companies or I'm fighting with the hospitals. When I'm representing the hospitals, I'm sometimes fighting against my practice or potentially even the state of Delaware. When I'm representing the state, I may be fighting against the systems or the payers. And so what's the common thread? And ultimately, it's the patient, right? And so when I became chair of the Healthcare Commission, I thought, what is my true north? And the true north is the patient, and the true north is the quadruple aim. And so that message that I've been trying to carry out as chair of the Healthcare Commission is starting to take root in some of the plans and policies that the state of Delaware is going to be working toward over the next several years. And so it's an honor to represent Governor Meyer here today and talk about this. So I want to thank all of you for the work that you're doing. This is the 13th year. That's a long time, and it's a critically important piece of not just healthcare, but our economic policies for the state. So once a patient gets into the buildings next door, we've started to lose that battle already, right? If we're not dealing with chronic disease, if we're not dealing with population health, if we're not dealing with the social determinants of health, it's impossible for us to bend the cost curve, right? And so the focus today on chronic disease is critically important to the economic stability of our state that spends $11 billion. Delawareans spend $11 billion on healthcare, right? That's just unsustainable. And the benchmarks that for the last 7 years have been used to determine the appropriate rise in cost of healthcare are based on economic metrics, right? Not based on the health of the population, but based on what is our state economic output. And so these two incongruent problems need to be aligned, and the only way to do so is through chronic disease management. And so it's incredible the work you're doing. And I just want to give you a little bit of light into some of the ways that we look at it from a state level. So per capita, Delaware gets about $80 in NIH funding, which is not terrible, but we have great opportunities to do more. So Pennsylvania gets $168 per capita. Maryland gets $388 per capita. Rhode Island, which is a state very similar to Delaware in many, many ways, gets $222. So why are we behind those states? And one of the reasons is that we don't have a medical school. And so something the governor is very enthusiastic about is the development of a medical school in the state of Delaware. That's something he's asked me to work on. And so the question that people ask is, why do we need a medical school in Delaware? And the answer is, we don't need a medical school in Delaware, but it offers us great opportunities. And so the opportunities that it offers are increased access and increased quality of care, right? So if we have an opportunity to bring care to the patients who don't have access, we have opportunities to reduce the cost of care. If we have opportunities to bring in more academic physicians, more residents, and more undergraduate medical students, we will have more research and we'll have more opportunities to improve the quality of care and the reach of that care. And we have the opportunity to increase our research funding. And so, you eat an elephant one bite at a time. And the work that you're doing is one of those bites. And what we in the state of Delaware look forward to is continuing these efforts, continuing to take a bite out of that elephant, because without doing so, we can't bend the cost curve. We can't care for our communities. And it's an honor to be here. The governor wishes he could be here. And we thank you for all the work that you're doing. Thank you very much for your time.
Dr. Hochstein, thank you so much for those inspiring words, and thank you for representing Governor Meyer. Let's give Dr. Hochstein another round of applause, if you would. Thank you.